This week marks 5 years since 20 children and 6 adults were killed at Sandy Hook Elementary School in Newtown, Connecticut. The massacre renewed the gun control debate in the United States, but ultimately did not lead to any major policy changes. According to new CBS News polling, 68% of the country thinks better mental health screening could help a lot in preventing gun violence. Less than half think more armed guards or more guns will help with gun violence. CBSN sent producer Christina Ruffini last week to Colorado Springs to hear from Americans with different views on guns and gun control. We interviewed them in pairs. They sometimes disagreed, but often found common ground. This clip focuses on active shooter drills in schools.
This week is the 5-year anniversary of Sandy Hook, which was one of the worst mass shootings in the country. 28 people were killed. A lot of them were 6- and 7-year-olds. Do you guys remember where you were when you heard about that shooting and what your reaction was?
I feel like that was a really big turning point for America, in my opinion, in that not providing any substantive legislation after that point, in my mind, made it okay that these kids died. No one seemed to care. I mean, if our most innocent and vulnerable population is not being protected a little bit better and there's not going to be some move towards let's rethink our position, it's never going to matter.
I was newly married, obviously, didn't have a kid at the time, and I didn't understand the mentality of it. Now I have a kid, and I couldn't imagine what those families went through, and how do you prevent that tragedy, and how do you stop that? I wish I had an answer for that.
I got an email a couple of weeks ago that my daughter was participating in active shooter drills, and they were teaching them to hide. So they wanted to alert the parents in case the kids came home and talked about, we hid from Miss Melissa today. And I just found it so disheartening, and honestly, it made me really angry, and I felt like someone's right to own a piece of metal was infringing on my child's right to live. It frustrates me immensely that we have to have those. And I feel like Newtown was the big turning point for that.
When I went to school, it was fire drills and tornado drills, and unfortunately now it's hide from Miss Melissa. You know, it's kind of back to when kids used to have to hide under the desk in case there was a bombing or something, you know. Mm-hmm. It is the world as it is, and I'd rather have my daughter, when she gets to that point, be prepared. It sucks. I'm never going to disagree with that, but I'd rather have her know than not know and be
sure, I agree.
Be open to it.
One solution that gets raised in the wake of mass shootings is to treat gun violence as a public health issue, which would include funding it as such. In 2015, a Republican-led panel blocked a proposal that would have reversed a 20-year ban on funding for the Centers of Disease Control to research gun violence. Earlier, I spoke with a former recipient of CDC funding for gun violence research, Dr. Fred Rivara. He's now a professor of pediatrics and epidemiology at the University of Washington School of Medicine. Should the United States be treating gun violence as a public health issue, and what exactly would that entail?
It very much should do. Now, in the United States last year, there were about 36,000 people who died of gun violence. That's an enormous public health problem. It's almost as many people as died in motor vehicle crashes. And to study it as a public health problem, we need to understand who is at greatest risk, who is at greatest risk of repeat injury, to put in place effective interventions and evaluate them.
And how would approaching gun violence, specifically through a public health lens, help prevent gun-related deaths and injuries?
Well, if you look at what's happened with motor vehicle crashes, there's been a 95% decrease in the rate of crash deaths per mile driven in the United States over the last 100 years. And that's because we have data sets that track who has cars, who drives cars, the miles driven, the crash effects in cars when something happens. We have regulations that makes cars safer. We don't have any of that for guns. We have no idea who owns a gun. We don't have any idea how many guns there are in the United States. We don't have any idea what happens after you purchase a gun. We don't have any real data, and we don't have any research on gun violence.
Well, based on your research, what are the impacts in terms of deaths and injuries of having a gun in the home?
We know that having a gun in the home actually increases the risk of violent death in the home. When I say violent death, I mean homicides or suicides. What people don't realize is that over 60% of the gun deaths in the United States are actually suicides. And having a gun in the home is going to increase the risk of having a death in the home dramatically, primarily by increasing the risk of suicide, but also homicides. In fact, for every time that an intruder is shot entering a home, 43 people in the home would be killed by guns.
Wow, that's a pretty sobering statistic. Let me ask you about funding for this issue. Funding for research on gun violence lags behind other leading causes of death. Why is that?
Why is that? Well, it's because of the NRA. We did some groundbreaking research in the 1980s that was funded by the Centers for Disease Control and Prevention. The NRA didn't like that, although it was published in the New England Journal of Medicine, and they criticized it, and they were able to get Congress, specifically some senators, to withhold funding from the CDC for gun research. That was in 1996. So for the last 21 years, there's been no funding by the CDC for gun research.
And what would you say to Second Amendment proponents who would argue that conducting research of this nature, in the way that you laid out in your car example, for instance, would inevitably lead to restrictions on their Second Amendment rights?
Well, I understand their worries, and I feel like we need to take those seriously. But we also have to realize that we all agree there are people who shouldn't own guns. There are people who shouldn't have access to guns. We all agree that guns should be safely stored in their homes. We need to do research to understand how can we make guns more safe than they are now? How can we prevent people who shouldn't have guns get access to guns? Those are the things that research can help us do.
And how has the current political climate affected your own ability to conduct your research?
Well, it's been stifling because of the effect upon funding. Fortunately, I live in Seattle. The city of Seattle was the first municipality to actually fund gun research, and they gave us funds to look at the nature of the gun injury problem here in our city and our state, as well as now to conduct a research study to try to prevent recidivism after gunshot wounds. But we are very fortunate in having Seattle support us. That's not true of most communities around the country. Most communities around the country cannot afford to support gun research, and as a result, there's not very much gun research that's being done. And the political climate is such that we know Congress is not going to take action. We know that 5 years ago we had the Newtown shootings where 20 children died. Well, since that time, there have been tenfold that number of children who have died from gunshot wounds, and Congress has not done anything.
All right, Dr. Fred Rivara, thanks very much for your perspective. Appreciate it.
Thank you.
Again, Thursday marks 5 years since the Sandy Hook shooting. That night, we'll hear more conversations among Americans with different views on guns and gun control. The program is called Mass Shootings, 5 years after Sandy Hook. That's this Thursday at 8 p.m. Eastern and Pacific, right here on CBS.